Hello and welcome to another edition of Heart of Healthcare. My name is Dr. Jan Bonifer, and these podcasts are about helping physicians restore balance in their lives so we can co-create a medical system that benefits everyone. A quick reminder that you can find more information about our not-profit heart-based medicine and the work we do to support healthcare professionals at heartbasedmedicine.org.
Welcome to the Heart of Healthcare podcast series, episode 4. Today we're asking, should physicians and healthcare professionals be prioritizing their own self-care?
In our profession, we're often expected to face crises and dilemmas that would make most people go weak at the knees. We're also encouraged to overstretch ourselves physically, mentally, and emotionally most of the time. By working extra long shifts, assuming a lot of responsibility and not having enough time to recharge and replenish ourselves. How can we redress that balance and make sure that we're showing up with our shelves fully stocked? So please allow me to introduce my friends, Dr. Dan Dinnenberg, back at the show, co-host of this show from another side of the blue planet, calling from Kauai, and Dr. Pete Churn, GP in Scotland with a surgery in Cockenzie and Port Seton near Edinburgh. He is a GP trainer with a passion and communication skills. And you're both, Dan and Peter, working at the front lines in primary care as gatekeepers of your respective health systems dedicated to lifestyle and holistic medicine. Thanks a lot for joining me today.
Thank you, Jan. It's a pleasure to be here.
Thanks very much, Jan. Very excited to be here with you tonight.
Welcome. So let's dive into 3 pressing questions that we wanted to start with. So let's take the first one together. And at these pressing times, what are the most effective ways for healthcare professionals to prioritize their own self-care? Peter, can I ask you to get started with this?
Well, thanks, Jan. I mean, isn't it interesting that we seem so much more comfortable giving advice than receiving it ourselves? And I think that so often we have the illusion that the choice is between looking after ourselves or looking after our patients, and we can find ourselves in these busy, frantic days of patient after patient where the decision to stop and do something that might nourish ourselves and set us into our afternoon with a new sense of vigor and enthusiasm actually kind of makes us feel like we're compromising patient care. So I think really the decision is seeing it a little bit differently. I mean, I see it that we're actually making a decision not to sacrifice patient care, but actually to look after ourselves, to show up in a different sense for our patients. And I think if we don't, we arrive hungry, angry, late and tired. And I think it's just about creating a space to pause and start really small. I mean, I think we all know what to do. We all have our little individual menu of sleep and nutrition and exercise and relaxation that works for us. But we just need to breathe a little bit and just create a tiny bit of space to put that into practice and show up for our patients in the best way that we possibly can.
Beautiful. Yeah. Don't we know that dilemma? It goes in both directions, with the patients and our own families sometimes. Kind of spreading ourselves between, I really want to take care of this patient right now, and at the same time we know it's time to return to the family and we also care for them. So we see this in all directions, with our patients, with our family, and with ourselves.
Yeah, I'm not so sure that when we limp into our houses at 7 o'clock at night after an 11-hour shift, that's a triumph. And maybe maybe we haven't made the best decisions that day, and we can give of ourselves as much as we can at work, but we've got to leave a little bit left over, haven't we, for our families and our loved ones.
Yeah, beautiful. Dan, how do we do this so that we have effective ways to take care of ourselves and actually arrive at both the workplace and at home with our shelves full? Is that possible even?
It is possible. It's obviously a challenge in healthcare today, but I think what Peter is saying, I think you're right on. I think most of us are better at giving than receiving. That's sort of part of who we are, kind of entering into this field. And I think that pushing on that a little bit further, there's a virtuous cycle that can be created with exactly what Peter was saying, where we start to see that the more sleep that we get, the more that we're eating nourishing foods, the more we're exercising, the more that we're feeling really good, then we're actually showing up and we're being seen by our patients. And so ultimately what that's giving us is this more accurate diagnoses, or more potential for bringing our own intuition into healthcare, or just feeling like we're doing something. And then that actually pushes us even further, so we actually feel a sense of accomplishment. And so then we're prioritizing our own self-care and feeling like we're doing a good job in total service to someone else. And I think the way that we do it, I think all of us could agree that one of the challenges is time. You talk about limping at 7 p.m. coming home. All of us wish that we had more time in our day. And so I think one of the ways that I've been able to successfully do it is to create ritual in appointments that already exist. So in between an appointment, if I could just stop for a moment and do my, 30-second breath, if I could then ground into the earth and do kind of a posturing or a healthy self-talk or some sort of mindfulness practice or one of these skills that I use, but instead of saying, oh, I need to create this time, a couple hours to do it, you're just doing it on the fly. And you're doing it in between as we set up the day. And so I think the important thing there is to set the intention for that early in the day, to create that space, the time to do that as the day progresses. And then there is a moment when we come in and we know, like Peter's saying, you get home to your family and you're off. And we can create that boundary. And even though there's charting to do, there is this period of time that we just drop into that. And then we get to feed ourselves, not only from our own lives, but then also feel in the feedback that happened that day. It's like, oh, I got that nourishment. I got that person that really I showed up in that way. And so that's the virtuous cycle that I started to talk about. It's sort of then what happens is giving is actually a part of our receiving. And so we've created something that is actually a sustainable model for us to move through our days and feel really good about it, as opposed to, the opposite, which is just, at some point just getting completely burnt out.
Pete, come on, after this. Yeah, you're burning.
I couldn't agree more, Dan. And I love what you say also about role modeling this behavior for our patients and for our staff as well. We've been running weekly yoga sessions in the practice, and one of the kind of negatives from some of my colleagues was, what are the neighbors going to think? Next to the surgery, if we're all outside in our scrubs doing yoga poses, we should be in front of the computer screen and doing results and seeing another visit. I thought, no, that's exactly wrong. We've got to talk the talk. We've got to be the ones that stop pedaling our bikes with square wheels and listen to our colleagues that are holding this round wheels and telling us to take a break. And the other thing I love what you said, Dan, is about just incorporating into your life, tiny little habits, sticking on a good behavior onto it. So, maybe even it's turning a kind of mundane task into something that's really enjoyable. So at the end of the day in the surgery, when we're looking at our letters and results, we've all got the music cranked up in our different consulting rooms, and you can walk down the corridor and it's like you're at, toggling between sets of Glastonbury, but we're having fun and we're just trying to bring a bit of amusement and fun into the daily workload.
Oh, fantastic. That's so beautiful, because so many of us are like caught in this dilemma that you outlined so beautifully in the beginning, right? So what can I do? And then kind of you find yourself as a victim in a catch-22. And what it really takes is to see that we're not the victim of our circumstances or the healthcare system. If we are ready, if we dare to care for ourselves, right? If we dare to actually go out of our comfort zone and be somebody that is not maybe what we want to see or what we're used to see about ourselves or what we feel we need to present to ourselves. And then suddenly, with a new sense of self, there is the courage to do so and take care. And then a new cycle begins. It's beautiful. Thank you so much. It's amazing. So taking time is such an important piece. So this kind of leads us to the second question, is that emergency workers in the fire services, and we know this from many other professions, that they're taking time after every call out, after every mission, to reflect and support each other. And I wonder, is that part of general clinical practice? And if not, can we introduce more collective support? How do you deal with that in your respective settings, Dan?
It's amazing to think that within these other settings, it's built in, because it makes so much sense. Of course it should be. It's sort of like an offloading of the energy that we just kind of created together. So if you're in an emergent situation or you have a really difficult patient, it's just to unwind from that. And it almost feels, as you say that, a service not to bring that energy into your next appointment. Right? If you just had that and sort of still sitting on you or challenging you in some way, it feels like a really important place to move that. One thing in our training, and I don't know about you guys, Peter and Jan, but we had M&M rounds, which was morbidity and mortality, right? And so that's the closest thing to a movement of, hey, there's a bad outcome or something happened, and we're gonna create that for the community. Now, in its inception, maybe a good idea, but I imagine that you work incredibly hard, something actually happens, an outcome that obviously does happen in medicine, and then now you're the one that has to prepare and sit on almost a tribunal in a grand round setting and feel like, it wasn't, to me, it was more bureaucratic and, maybe what we can figure out on a systematic level than what we're talking about now, which is this sharing, the emotional, the heart of what we do in healthcare every single day, and be able to kind of create something. So, is there room for us to have accountability partners? If Pete, if you're talking about these rooms and, all of you guys are rocking out, is there a place that you could also say, hey, look, I had a tough patient. This is what happened. And sort of like, and I think right now what a lot of us realize is we're living in this, a lot of us have our pods that we're working in or we're living in. We're no longer in silo. And so can we have those people in support of one another, like coaching, and then be able to share our vulnerability? Would that change so much in how we show up in healthcare? So we don't have a place for it right now. It exists, but much more on what I feel like is a bureaucratic level. And what we need is that true vulnerability and sharing of what we're going through. And I think that, Pete, another thing that you mentioned is kind of like modeling and talking the talk. And what happens when we share, when you have now you're the attending physician and you have younger people that you're training and you're truly vulnerable and you're saying, you know what, I'm still unsure if that was the right diagnosis and this is why I did it. And that honesty and that vulnerability sets the stage for other people to be fallible. And in that process of becoming fallible, we're no longer in this mode of being the martyr, of being someone that needs to be perfect, of being held to this very, difficult place that we hold ourselves to. And then all of a sudden it becomes more real. And then, to be very honest, in my opinion, you're getting giving and receiving better healthcare because you're showing up for someone and you're giving them your expertise, but you're not acting as if you're the one that knows the answer. You're showing up and you're co-creating and you're believing and you're bringing your wisdom and your expertise, but you're showing up in a different way.
Yeah, I mean, I couldn't agree with that more, Dan. And I think actually in terms of role modeling that, I think showing up with our patients with a sense of vulnerability and discovering the answers together is so much more powerful, isn't it, than that old patriarchal model when you go and see a doctor and they're the parent and they're going to tell you what to do, and I think as long as we're trying to kind of, have these adult conversations and really just find the answers together, it's so much more powerful. And I love the analogy with the fire service, because I think one of the things is that if you're a fireman, occasionally you get to put out the fire. And I think one of the problems for doctors is that, our world is smoldering all the time. We never put it out completely. So if we wait for those pauses in the day where there's just going to be, clearing smoke and the shafts of light coming through, we're never going to find the time. So I think we just need to kind of control things and actually create a space to spend some time with our colleagues and to debrief and to heal each other. And I think, Dan, you're absolutely right. I mean, I think having trainees in the practice, we've got medical students and then we've got trainee GPs with us all the time. And it's been hugely helpful for me because, you know, the last thing I want them to think is that I've got all the answers all the time. And I don't want to role model to them that they need to know the answers all the time. So I think most of our trainees leave their placements with us thinking that I'm a complete basket case that probably doesn't know the answers to anything. But, you know, I think it's just coming at things with a real sense of curiosity and openness and honesty, and just willing to kind of learn both together with our trainees, with our colleagues, and ultimately with our patients as well.
Fantastic. This is like, I think we're just kind of uncovering the second, what does he call it, stigma here. So one is kind of a doctor behaves in a way that is sitting behind the computers, rushing down coffee, always running emergency mode. And now, thou shall not relax and recover because thou are on call. So that's one. And the other one is what you just said is that actually we do need to reset. We're humans too. And we need recovery and we need to introduce balance and take the time for that. And yet again, that is kind of stigmatized, You're kind of, I guess, at least it's one part of me that then says like, don't show up weak, you can you can do this, you don't need a break, push on, be a tough cookie, So there's that one part that is really deeply instilled in my kind of how to behave rucksack.
It's that pride, isn't it, of being a trainee junior doctor in hospitals and doing 100-hour weeks and entire weekends and emerging at the other side of this weekend like a conquering hero, where we just, it's very hard for us to unlearn that mentality, isn't it?
Yeah, who are we trying to please could be a question. So was it Ram Dass saying like, why do we take all that pain for a little bit of consolation? So here's my third question to you, because we discovered that there is all this freedom that we actually have if we're willing to kind of step out of our comfort zone and out of our belief systems, who we need to be. And yet, we are not alone. There's so many fellows experiencing this. So many colleagues of ours are actually experiencing a really rough time of, exhaustion and depletion and frustration and, empty batteries, I guess, is really the feeling that many have right now. So it is tempting to think about systemic change. And so how could we create a system change in this direction that would benefit all healthcare professionals? Is this a possibility or a mere dream?
Jan,
Pete.
Is that for Pete?
You go ahead.
You go ahead, Dan. You go ahead.
Thank you. I was just excited to talk there because I love the analogy, and I think that bringing the systematic change, I can get there in a moment, but when you guys were talking about the fire, I think that what happens is, imagine there is this creation of the energy of this the stress response, and then naturally you put out the fire and there's a relaxation. And when you guys were talking about it, it's the smoldering, right? And so Pete, bringing that into a systematic change, it almost feels like you just mentioned like the ability to unlearn. That's hard. That's a very challenging discussion. It was like how to unlearn the martyrdom, the 100 hours, the conqueror, the like, I did this and that's who I am. And now this is my identity. So the systematic change that I got excited about talking about was ultimately, where in this process do we start this learning? If we're modeling it as these attending physicians and kind of, with the people learning coming through now and allowing that modeling, and even bringing in people into the profession for their emotional intelligence. for their ability to bring balance and the expertise, to be the bridge between, someone that can hold this expertise of this, the science, and translate it with their emotions. And to hold, that's something that's systematic. That's something that we need to be looking for in who we're bringing into the profession. That's in the very beginning of the training process, and having time to create that. So it's not a smolder from the beginning. It's ultimately like, this is what we're doing, and we're having these blocks, and this is what we're teaching, whether it be, teaching the skills of, that some of us learn along the way that we kind of pull off, as sort of, whether it be our meditation or our athletics or our downtime or our connection or our food or all of these things, and embed that into the programs as we grow. And so by the time that this person is trained and has been through the process of becoming a professional, it's like a trade school. It actually is something that they've learned all these skills, and now they're there to model. And I think what's so important there is then we're going from the unlearning and the unpatterning that some of us have to deal with to just the training, and that this is a part of the process. And I think where it becomes incredibly important right now is, I believe very strongly that that is an incredible place for us to live in the future of medicine right now, is like that emotional side of that connection with another human being and be able to translate is actually our skill set. And so really hone in on what we're really actively trying to do here. And so bring that human side, the humanity and the emotional intelligence, into what we're doing as a part of the training.
Yeah, that's lovely. I mean, I think that the other thing that comes to mind at the moment is that, the COVID pandemic has been a forest fire. This has wiped out overnight how we interact with our patients. And in the UK, we've gone entirely to a kind of telephone-based triage first, and we're seeing so far fewer patients face to face, and we can change these things incredibly quickly. I'd like to reach a point where, I mean, actually, Dan, you mentioned trainees, and the great thing in Scotland, part of the Royal College of General Practice training scheme, they have these 13 core capabilities for our trainees, and one of them is that their own fitness to practice. So as they go through their training every 6 months, they need to demonstrate pieces of evidence that show that they are looking after themselves and are actually learning those skills as an integral part of being a UK general practitioner. And I think I'd like to imagine a world where we have an annual appraisal. I don't know if that's the same in the States, but we have to submit evidence each year for our ongoing continuous professional development. And we have to log at least 50 hours of training. And I don't see why we don't have to log 50 hours of well-being activity. What about showing up to an appraisal with a wise mentor who says, well, Dan, thanks very much for your latest learning about, surfing shoulder injuries and how this affects the heart mind. But, could you tell me a little bit more about how you've been getting outside and stretching between patients, and, your new kind of 1 minute yoga micro practice that you've been doing with patients? I just think that it could be systematically, part of our responsibilities for our patients, and evidencing that every year seems to be a good place to start.
Oh, wouldn't that be fantastic? Are you already including this, Pete, in your kind of training as a GP trainer? Do you see ways to do this, and how is it being taken by your successors or by the young folks, by the next generation?
Yeah, well, our trainees have to do a quality improvement project, and the weekly yoga, actually, usually these projects are rather dull switches of warfarin to kind of newer anticoagulants. But the most recent quality improvement project that I encouraged my trainee to do was the weekly yoga. So she had a background in yoga teaching, so that's how that came about. We'll take us through some moves outside and write it up really as a demonstration of how to change a practice. And actually, we learned a huge amount from it. for both what went well, but also what didn't go well. I think the other thing that we learned was that, you can't be prescriptive about it. It's got to be a very individual thing. Different people like to do different things. And I think you just need to define a time in the day. You need to set an expectation that you're going to look after yourself. And then, you need to role model the sorts of things that you can do to start small. And I think force the GPs that are still pedaling their bike with square wheels to maybe get off and, maybe just lie down and try a yoga pose rather than frantically pedal.
So one of the challenges to systematic change is very interesting. You look at systemic change, and like I offered a resiliency program to healthcare professionals, and I did it on a volunteer basis where everyone showed up, and every week we were doing something different. I was focusing on compassion in our lives, or gratitude, or how to find your flow. And the number of professionals, number of people that showed up was so much less than when it was a systemic or a systematic movement from the whole practice saying, hey, we're giving you time in your schedule. So instead of 16 patients or 22 patients or whatever they're supposed to see that day, they now have an hour blocked off. Everyone shows up. And so it's interesting because we could always say, oh, this is amazing. We have this incredible, but once we are supported. So this gets into a much deeper conversation of what's really going on in sort of the productivity in medicine and sort of what we're up against. And I think that that's something that we really need to address, because ultimately we can sit here and kind of figure out what is absolutely the best modeling for teaching. But if we're not hitting sort of the productivity or sort of the kind of the money behind the medicine, then all of a sudden we're in our own world. And I'm really curious, Pete, what is your thoughts on that?
Yeah, I mean, that's really interesting, Dan, because actually it resonates with an experience that we had. I ran a series of lifestyle health walks for patients. So the first Tuesday of every month, I would just wait outside of the surgery. We've got a big kind of garden, and I would just take patients on a walk. And we would sort of walk around the community, and I would stop them at little kind of nodes, and I would talk about, firstly, sort of mental health issues and why we were doing the walk. And then we would talk about sleep, and then we would talk about nutrition. We'd talk about movement, relaxation, and then we finally ended on connection and trying to enable this army of community volunteers. And what was important was getting enough people in to match against what I would be seeing in a surgery. So for my partners, they really wanted me to be hitting numbers of getting at least 13, 14 people on each walk to justify it as an ongoing intervention. And for me, I felt that it missed some of the unmeasurable benefits for our community, just to be seen, to be out in the community, to be walking, to being in nature, and just the goodwill that the practice community felt from seeing their health professional walking around and just teaching groups of people. So that's interesting, because it's exactly the same challenge that we came across.
It's amazing to have to speak the language sometimes of, an organization, because I think where I became really successful at getting buy-in was, hey, if one of these people end up leaving the practice, what is that going to cost the organization to onboard to all of the ways that we do what we do? And all of a sudden, the realization was the incredible cost of losing somebody. And this is just somebody that is retiring or moving to somewhere else. This isn't the suicide, the depression, the really intense losses that could occur in medicine when people are truly burnt out at this level. But ultimately, it took the understanding from a financial buy-in in order to create something like that. And then all of a sudden it became much different. If 6 people or 8 people showed up deeply connected and they found their creative juice within medicine again, it became wildly successful.
Yeah. And Dan, if you were joining a practice as a physician, Would you want to join a practice where one of your sessions is leading a group of people walking along a beach? Or would it be in front of the computer and trying to hit your 15 patient target?
Exactly.
Oh, fabulous. What would it take if we're not only feeling great about taking care of our patients, but also actually feel great about taking care of ourselves and of our colleagues? Wouldn't that be a bit of a system change? Fantastic. Well, thank you so much. It's been a really a very quick but real deep dive into these questions. And Dan and Peter, I just want to really thank you for joining me for this amazing and inspiring conversation. Thank you for being in the show, and I hope everyone out there that you enjoyed the chat with the doctors Dan Dillenberg and Peter Churn, and you can find more information at heartbasedmedicine.org. And I deeply appreciate if you could click subscribe on whatever platform you've been listening to this podcast on. Until next time, folks, thanks for listening and take care. We hope you can join us for the next podcast in our Heart of Healthcare series, when we'll be asking, is it time to challenge the stigma around mental health issues for healthcare professionals? If you like this series, you might also enjoy our accompanying book, Dare to Care, on Amazon. Join the Heart of Healthcare discussion at heartbasedmedicine.org, where you'll find lots more interesting interviews, articles, and training materials. See you there.
This has been a Heart-Based Medicine production. Thanks for listening.